Hi, my name is Isabel Adeyemi, and I'm a research associate in the National Institute for Health Research, Greater Manchester, Patient Safety Translational Research Centre. The centre focuses on research to improve patient safety, and I'm going to talk to you about the work we've been doing in the centre to develop some research on patient safety in maternity outcomes for Black and Asian women. The research is being developed in partnership with Health Innovation Manchester and NHS partners, and through links we made in the Greater Manchester Public and Community Involvement and Engagement Forum, we also partnered with charities and community organisations in developing some research ideas in this area. In particular, we've been working with the Caribbean and African Health Network, which focuses on removing health inequalities for Caribbean and African people in Greater Manchester. And we've also been working with a charity called Awakening Minds. This charity is a specialist Punjabi service providing community-based mental health supports. As a starting point, before developing a research proposal, we did some public involvement work. This was an important precursor to research by letting the target population of the research help to define the research itself. We wanted to speak to women from ethnic minorities and to find out from them what their experiences of having a baby during the COVID-19 pandemic has been, and what they think research needs to prioritize to improve their experiences of maternity care, and also to improve the well-being for the women and their babies. The Caribbean and African Health Network and Awakening Minds were instrumental in carrying out this public involvement work. Together, we agreed some initial questions as a starting point to get the discussions going with the women. And I've been working with Nasrine from Awakening Minds and with Faye from the Caribbean and African Health Network to co-facilitate these discussions. Afterwards, we discussed the points raised by the women to help inform what the focus of potential research studies in this area could be. We're currently in the process of developing some research proposals on improving communication about vitamin D with women of colour, and about how Black and Asian women can be empowered to voice any complaints they may have from their experiences of maternity care. And this work stems from the discussions we had with the women. The focus of this presentation today, though, is to tell you more about how we did the public involvement work and to show how the partnership with community organizations was vital in doing this work. There'll be two videos that follow. In the first video, I speak to Nasrine Akhtar from Awakening Minds, ask her about how she found being part of this piece of work has been, and also her role in contacting women who had a baby during the pandemic and asking them about their experiences. I also asked Nasrine what key messages she would like others to know when thinking about approaching women from ethnic minorities to ensure that the interaction is sensitive, respectful, and worthwhile for the women. In the second video, I speak to Dr. Faye, who is chair of the Caribbean and African Health Network, and I ask her the same questions. So just before starting the videos, I would like to thank both Awakening Minds and the Caribbean and African Health Network for their input in this work and in continuing to develop it. Okay, Nasrine, so just give us an introduction about yourself and the charity that you lead on.
Okay, so my name's Nasrine Akhtar. I'm the director of and the founder of an organisation called Awakening Minds. We specialise in mental health support and services and training, and particularly for those from the Punjabi community where English isn't their first language. So that's who I am.
Okay. So how did your relationship with the Patient Safety Centre, how did that partnership start?
Okay, so just pre-COVID, I remember very clearly researching so much. I was so eager to be heard, and I had seen so many inequalities and challenges within my own communities and myself, my own experiences, and I was, searching online on how and who and what can I do to be heard. And I stumbled upon an opportunity from Health Innovation Manchester to join a public community involvement and engagement forum, where I had the honour to meet Nikki and Anila. And it was the very first face-to-face meeting we had in Manchester. So that's when I met Nikki and Anila. And from there, COVID happened and the relationship then continued online and opportunities developed. Nikki contacted me, Anila would contact me. And they were very aware of the work I was doing and the engagement, the relationships I had built. So it actually embarked from their opportunities, embarked from there.
Okay. And so you've been doing some work with me. You've been doing quite a bit of work with me, and it was looking at doing some public involvement work with women from Black and Asian community groups who've had a baby during COVID. So we did this work back in November, and we've been continuing it since. So do you want to say a bit about what your role was in this particular piece of work?
Yes, so my particular role was in developing and building relationships. So it was predominantly on the ground engagement work, particularly for those ladies where English isn't their first language. And it's not often that they talk about their experiences, their personal experiences, because within our cultures, traditionally, we've been raised to be very resilient and not air our own experiences and feelings publicly. So my key involvement was to firstly build that trust, which takes a lot of effort and energy. And in order to do that, you have to be very congruent and let them feel you, not just see you and hear you, sorry. Building relationships and allowing them to feel comfortable, to be able to share their thoughts, feelings, experiences without being penalized or judged for it, which is not often found in our communities. So I was meeting them where they are rather than they meet me for my purpose or my need. And I feel I have a skill and a very unique position during COVID, where people see you as somebody they can trust and think, okay, I need something, I'll go to this person. I know they'll help me. And that comes with its own responsibilities as well. But then to ask something in return and ask them to share their most nearest and dearest experiences is not easy. So my thing was to make sure they feel comfortable, make them feel they mattered. And we want to hear, and your opinions and thoughts are valuable to us. So I tried to build and successfully did build relationships, but I met the person where they are. It was very challenging. It's not easy, because I remember Isabel, myself and you, we had discussed how we would go about engagement, and we had planned on discussion groups over Zoom or Teams online. And although we had planned that, it just did not transpire because of the challenges ladies feel. And especially with COVID as well, there were so many other barriers that we couldn't overcome. So it was, I wouldn't like to say it was hard work, but I'd say it was heavy heart work. Which is random timing, suitable timing for them, privacy, where they're, especially with COVID, when everybody's stuck at home and isolated, where they can find time and space to speak openly without being heard, without offending somebody else. And I would say to researchers, meet the person where they are, take time out. It's not a tick box exercise. And it's okay to talk about other things which are not related, because they do interlink with each other. And don't only listen to what they have said, but listen to what they didn't say, how they said it. Did their facial expression change? Did the word they used, what does that word mean to them? It has a different meaning to us. And if they go quiet for a moment, be comfortable with silence as well. Let hold that space for them and not for your answers. So, yeah.
My name's Faye Bruce. I am the chair for the Caribbean and African Health Network in, well, we're actually a national organisation now. It started in Greater Manchester in 2017. So Khan started with some of my work around health disparities in the Black, Caribbean and African community. And it was from there really that communities were saying, you know, we don't have a voice, you know, that there are things that are happening to us and we're not involved in that. So how can we, from this piece of work, create a space around those decision-making tables so that we can influence, you know, some of those, you know, practices, policies, research. So I also do quite a lot of work in maternity. I just until recently was the patient and public voice lead for the Northwest, you know, for maternity services, you know, just really trying to get providers to take public voice, service user voice seriously, you know, so I did a lot of work there with the commissioners, with providers, etc. And I also chair the Greater Manchester and Eastern Cheshire Black and Asian Advisory Group, which again was started by Khan because nothing was being done about health disparities, the high rates of mortality in Greater Manchester. We knew it reflected the national picture, so we wanted to do something about it. So the advisory group was kind of born again from that. So yeah, so we had some really good discussions with women from across the African and Caribbean communities. So, you know, we often talk about, you know, how diverse we are as Black people, and what we did notice during those focus groups were that women's experiences did vary depending on where they were from as well. I think one of the things, and maybe many people know, that many Black people don't come forward to take part in research. You know, they're very reluctant to engage, and one of the most important things is having those trusting relationships with people, regardless of what kind of research it is. You know, to have those trusting relationships where people feel that they can be open and honest and transparent about their experiences. And the fact that, you know, many of us that do the work in Khan, for example, we're all Black people, and we do tend to get that level of engagement that we need. So it's just really crucial. And I think another thing is how, you know, when people do come forward, they often say, well, I come forward and then I give all of this information, but then I don't hear what happens. In the Black community, and I'll bring it down to maternity, there is a lot of fear. There's a lot of fear. You know, we've had quite a lot of evidence recently, you know, that has been brought to the attention of women that are either pregnant or, you know, wanting to conceive. And what's important is that, you know, the women understand that there is something not quite right in the system that's resulting in these disparities for them. And when we look at research, people just want to know that things are going to be different. People are gathering information, their experiences, because they want, you know, things to be different. And so, you know, what I would say to researchers is that, you know, it's about that, how you promote, how you engage, how you almost sell, you know, what you're trying to do, and in a way that people feel assured that it's genuine, it's authentic, and it's because they want policies to change, they want practices to change. You know, they want things to change for the better, or whether it's for them or their children when they have their baby. So, you know, it's about also being approaching things in a more co-productive way, so birthing people. It was really important. So that co-production, that co-design, you know, the co-interventions and all of that is really important. So, you know, it's one of those where people want to feel part and own something that they really believe is going to make a big difference to either them or their, you know, their families going through the maternity system. So yeah, there's so much learning that's come from this. And do I say there's lots of shocks in terms of people's stories? probably not, you know. You know, I have my own lived experiences of maternity when I had my babies years ago, and when I came back to this, it was very, very much, well, things haven't really moved on.
Yeah.
So it's about, we need change now. We can't keep having these higher rates of mortality and morbidity. Women were scared to complain because they thought if they went back to have a baby, then what's going to happen to them, how they're going to be treated. But, you know, we need to give people the tools to be able to say when something's wrong so we can do something about it. So it's preparing that environment so people can get some equity, get some better care overall from the services. So yeah, a lot of learning, a lot of good learning, but great collaboration with the patient safety collaborative, and yeah, it's just been a pleasure working with yourselves.
Oh, thanks very much, Faye. Thank you.